From the blood,
No, this is from the tumor that was resected. We hand it down on the tissue in the wax block stored in the pathology bank. So when do you think? When are you going to start the? When are you going to start the chemo? When are you going to start the radiation?
So I go May the 10th for my radiation markings.
Great.
And then I know the doctor said that he was going to get with you because when I take radiation, I can't do the infusion, but I can do the pills.
Correct. So far, have you what side effects have you had?
None.
No. Great, wonderful. This is the report. So the report, there are three things that's very significant for your care. One is this is HER2. So HER2 in this, we need to find out a little more about this HER2 test. But PD-L1, you have a CPS5. So when you finish all the chemo radiation, we could consider additional immunotherapy in the adjuvant setting to lower the risk.
Okay.
That usually patients, if they have CPS score 1 or above, they tend to benefit from immunotherapy.
Okay.
Then you have this thing called BRCA mutation. The BRCA mutation, that's your young patient. And so I think, have you talked with the genetic counselor?
Not since I did the testing when I had breast cancer.
So the BRCA positivity, you know about. You know about, yes. Okay, so then you don't need to go back and. So are you germline BRCA mutated patient? Like from the genetic test, did you find those mutations?
From the genetic testing, yes.
Yes, I see.
Will I be able to travel or do I have to wait until after my treatments are over?
Okay. So you can travel. Where do you plan to travel to?
I just either Miami or Houston.
Okay, it's fine. The only time you cannot travel, it's not easy to travel, is during radiation.
Okay.
So that many weeks because the radiation is daily. If you're on chemo, you can always come back to do the infusion and you can take the pills at home. So you can travel.
Okay.
I have patients travel all over the place. Depends on how strong they feel.
Okay.
Yeah. Okay, great.
And my last day of treatment is when? Or are you saying that I have to take more treatments?
So what we have planned to do is to do 2 cycles now, and then May 10th you're gonna do the planning. So if you start, you start cycle today?
I start infusion today, and
no,
then tomorrow I start the pills.
Sure, tomorrow is May 3rd. So May 24th, you'll finish the last pill. And then I do not know when Dr. Unger will start radiation, but he and I will talk.
Okay.
And then you get the radiation. Then when you finish radiation, depends on how you feel. We may give you 3-4 weeks break.
Okay.
And then when you feel a little stronger, then you come back to do 2 more cycles, then we stop.
Okay.
Then we'll talk about should we give you immunotherapy in the adjuvant setting. The reason is, so immunotherapy in nivolumab has been FDA approved.
What is the
Okay.
immunotherapy?
Immunotherapy. So basically,
is that a pill or infusion?
it's an infusion once a month, a 30 minutes infusion.
Okay.
So it's a lot easier than chemo. Cancer looks different from us. Our immunity usually kills it before it forms a tumor. Until the cancer does some editing to the immunity, the immunity cannot recognize the cancer or cannot kill. And how did the cancer do that? They make those immune breaks to put on our immunity. the two scientists discover one type of immune break, won Nobel Prize 2-3 years ago. A lot of scientists trying to discover other immune break. So if your cancer use this specific immune break, then this treatment, this antibody once a month, not chemo, immunotherapy, break the immune break, will activate your immunity to attack any residual cancer.
So you think that still would be good, even though they said they removed all of the cancer?
So the nivolumab was tested in patients post chemo treatment, chemo radiation, and then they get, I have to check 1 to 2